Hey guys, so today we're talking about Meg's most recent blog, which is I Still Need to Touch You. And if you haven't read it yet, she'll give you a little synopsis of what we're talking about, and we'll go from there.
It's basically about our perspective of working with people who have, kind of a vague question because they have some pain somewhere or here and there, or they've had a history of it, and they are seeking our advice. So for example,
via like email
right.
or passing you in the hallway. They're not coming in as a patient, right? This is like they're reaching out.
Right, this is just the kind of casual conversation. And speaking of which, literally just a minute before we started this video, I ran to the bathroom. And along the way, a really wonderful worker of our building, who we actually know quite well, stopped me and asked me a couple questions on what I think is good from a pec strengthening perspective. So a couple things are going on in my mind. First is, do I answer the question as superficially as it came to me? Or do I actually give him the advice that I normally would give someone, which is you probably shouldn't be focusing so much on your pecs as you might need to be working more on the posterior chain of your body because of posture related things and because we're always so tight here. Blah, blah, blah. There's just so many levels that we could delve into with a question that is such a simple, innocent question like his. So basically, for, a matter of time, I gave him a pec exercise that I thought might be the safest for him, and that was it. But this kind of issue arises all the time. I would say, via text, we've had Facebook statuses and personal emails and late night phone calls. So
and cornered at a party, and you're asking, like, people ask a question and it's like the question is somewhere in here, but there's all this other stuff before that needs to happen, so the question is almost irrelevant. Plus, on top of that, like, there needs to be a full exam, there needs to be a history, there's so many other things that could go on. There also needs to be palpation to the area, and especially if you're not one-on-one with the person, there becomes a concern of, like, is all the information coming to you accurate, right? If someone says shoulder, do they actually mean shoulder or do they mean here? If they say hip, are they pointing here? Because we don't consider that your hip. So that also will guide the answer in a completely different direction. So the concern is, now are we giving you like accurate, safe information, and you almost don't even want to answer the question, but you're kind of cornered. So I think the point that we want to make is that if you have an issue that you're concerned about, the best route is to come in to get treated, or at least get looked at, right? And then they can assess one direction or the other. Asking a question like that and expecting to get a detailed answer is unfair. And it's unfair for us, and it's unfair for you.
Yeah, we only want to give you the best advice that we think that pertains to your body. And you can't see your body as the same body as, mine and Lindsay's.
Yeah.
They're different, so you have to imagine that the treatment would be different. I can't give you a generic answer for a generic question. We were talking about palpation a little bit. Palpation is pretty important because we were talking about it as an art. You have to feel the area, truly feel it, to know if it's swollen because of an actual injury and edema in the area, or if it's just spasmed. And it's not always easy to tell, or how well the joint is moving. So those things are really critical to figuring out and guiding how to care for this injury.
Yeah, you don't want to miss any piece of the puzzle. So I think the point we want to make is just come in and get looked at, because it may turn out it's really simple and we can say, oh, you're good, just change one or two things, or maybe it's more serious. So you want to know the answer to that question. So, just come in.
Yeah. If you have any questions, shoot us an email or call us.
All right.